Howdy. Welcome to the Texas A&M University College of Veterinary Medicine and Biomedical Sciences Peer Programs STEM Education Series. Today, Dr. Mark Stickney will present Keep It Clean. It's all about balance. Whether they're regulating their body temperature or fighting off disease, living organisms are in a constant balancing act in an effort to maintain homeostasis. Dr. Stickney will describe the structures and functions which help a body to stay in balance, as well as demonstrate techniques used by surgeons to ensure homeostasis, even if an animal's insides are exposed to the outside. Welcome, Dr. Stickney.
Thank you, Tori. Good morning. It is great to be here to talk with you all today about homeostasis and infections and helping to prevent those things. As we get started, the very first thing that we want to talk about is homeostasis. And this is a word, if we break it down into its etymology, homeo means staying the same, and stasis means not changing. So the idea of homeostasis is that the body is always trying to maintain an internal stability, keep everything just where it wants it to, without changing too much in one direction or another. If our body is suddenly not able to maintain homeostasis, this causes us to become sick and potentially die if our body systems get really out of control and out away from their normal point of where they want to be. So, as an example of homeostasis, let's imagine that this is two different sections of your body, and you can see that we have the same amount of fluid in each section. If something were to happen and more fluid started to move over into one section of the body, homeostatic mechanisms would kick in that would try to bring the body back into balance and get that same amount of fluid back into place. Now, another example would be if we look at a joint. So this is a knee joint, and we're going to say that this joint is perfectly healthy. So we have a nice white cartilage. The bone is very smooth. This is what we want our joints to look like, and this is what our body is always going to try to make our joints look like. If we twisted our ankle or sprained our knee, now we have inflammation start to occur, and this nice, smooth, white joint is now going to become inflamed. We're going to see blood vessels move into the area to try to, as a result of that inflammation, and over time we will see that that bone stops being quite as smooth. Our body is going to try to eliminate all of this inflammation and make our joint return back to a normal state. This is why when we sprain an ankle or damage a joint, it hurts. It hurts because we have this inflammatory process going on, which is the body's mechanism of trying to bring it back to a normal state. And sometimes the body does a good job of that, and sometimes the body does not do a good job of that, and that's when we have to see a doctor and take some other actions to try to maintain homeostasis. Now, let's talk about infection and how we can get an infection and a disease, and how our body will try to get rid of that infection. So, in order to have an infection of some sort, we have to have microorganisms. Microorganisms come in 4 different types, and in 5 different types, and those are bacteria, protozoa, fungi, algae, and viruses. And I'm sure all of us have had a cold before and a cold virus and have felt how miserable it is when we have that, and our body's attempt to fight it off means that we have a stuffy head and a runny nose, and we generally don't feel good. Our body is trying to make us rest while it returns to a homeostatic state. Microorganisms are present everywhere. They're all over our bodies, no matter how clean we are. They're in the soil, they float around in the air, they're in the water, They have even been found in extreme temperatures like Antarctica and the bottom of the ocean. Some bacteria and microorganisms are beneficial. They help us to process our nutrients. Our intestines are full of bacteria, and if we did not have bacteria in our intestines, we would have stomach aches and GI problems all of the time. But because we have what our body considers to be normal bacteria in our intestines, we are able to eat food and maintain a healthy lifestyle and absorb nutrients without any problems. But we do have some bacteria that are pathogenic. And you'll see sometimes in the news where there's been a food recall because bacteria has been found in the food, and that food has to be recalled before anybody eats it, because those bacteria will fight with the good bacteria in our intestinal tract and make us sick. So, microorganisms cause disease. A pathogen is a specific microorganism that has the potential to cause disease. An infection is when our body systems become invaded by the pathogen. And then the disease is the result of that invasion. It's all of the things that happen that cause us to not feel well and can damage our organs and our homeostatic mechanisms. When we have a disease, our bodies are at a homeostatic imbalance, and our body will try to get back to a normal balance. In order to become infected with something, bacteria, microorganisms have to be able to go through a few different steps in order to even get into our body. Our bodies are very good at trying to prevent that from happening and maintaining homeostasis. We're going to pretend that this is a microorganism. So, in order for us to get sick, this microorganism first has to find a way into our body. So, what are different ways that this microorganism could get inside of us? One would be through our respiratory tract, through our nose or through our mouth when we breathe. And this is a common way that people get sick when someone next to them coughs that is sick. And that's why we are supposed to cover our mouths when we cough, so that we don't, every time we cough, we are showering the immediate area with bacteria that may have caused us to get sick. And if you are standing nearby and inhale those, you will also get sick. Another way that we can get sick is through our gastrointestinal tract, our GI tract, through something that we eat. And we've already talked about that a little bit as it relates to eating something that could be in our food that would get us sick. We can also get sick through our urogenital tract. Bacteria can migrate up into our urinary bladders and cause a urinary tract infection, or get into our kidneys and cause a kidney infection. And then probably one of the most common ways that we get sick is through a break in our skin. Our skin is our very first barrier to any sort of infection. And when we have a break in our skin, that barrier has now become broken, and that allows microorganisms a pathway into our bloodstream to make us sick.
Got some questions for you, Dr.
All right,
Stickney, if
great.
you're ready.
Yes.
The first one is, why do some people get sicker than others when they have the same disease?
Okay, so the reason for that is that all of us are individuals, and all of us have immune systems that are a little bit different. So if, let's say that it's the cold and flu season, and someone next to you has a cold, and they spread that cold to you, and you get sick and feel bad, and they get sick and feel bad, but you get better. Now you run into someone else who has that exact same cold that you just had, that exact same cold virus, and they sneeze on you, and you become infected again. Your immune system has already fought off that particular cold virus once before, and it remembers that cold virus. So it is going to be much better at attacking and destroying it before you get very sick. So the first time you had that cold, you didn't feel very well, you were very stuffy, you were sick for a few days. You got better. The second time you're exposed to that cold, you're a little bit sniffly for a day or two, and your body then knows how to fight off that infection already and gets rid of it.
Right. And then the second question is, why isn't there medicine to treat viruses like colds?
All right, so that's a great question. And one of the reasons is that viruses are very, very good at mutating and changing at a much faster rate than bacteria. When we have a bacterial infection, we can take antibiotics, and those are specifically designed to kill bacteria. And they do that through a number of different ways, by attacking the cell membrane of bacteria or entering into the DNA of bacteria and killing them. Viruses are much smaller, and the way that antibiotics work does not affect a virus because it has a different strand of RNA and DNA and behaves differently, does not have the same points that an antibiotic could use to attack it. There are some antivirals out there for different viral infections, but they are not nearly as common as antibiotics.
Right, thank you very much.
All right, great. So now let's talk about how this microorganism, once it gets into us, is actually going to make us sick. Okay. So first, it has to reach its target site. So some microorganisms are better at infecting areas of our bodies than others. There's some microorganisms that will have almost no effect on us if we scratch our skin, but if they got into our bloodstream or into our gastrointestinal tract, they could make us really sick. So first, the bacteria or the virus has to be able to get to the spot where it will grow at its best. Once it gets there, it has to actually be able to attach onto that target site. So let's say that I have cut my hand, and I've got little bacteria that finds that cut. It gets into my skin, and this particular bacteria then has to be able to stick to my skin in order to start to cause an infection. Once it's there, one bacteria is no big deal. My immune system can handle that and kill that really, really fast. But once it's there, now it has to be able to start multiplying and making friends to help it create an infection. So it has to get there, and now it's going to multiply very rapidly. And as it multiplies, it will beat our immune system's ability to handle the infection. It's like if you were playing football and one team only had 3 players and the other team had 9 players on the field. It doesn't matter how good those 3 players are, they're not going to beat the team that has more players. As these microorganisms multiply, they all have to be able to eat and feed themselves to continue to multiply and to stay alive. So now that they're at the target site and they're multiplying, they have to be able to absorb nutrients, which means that they are now stealing nutrients away from my body that I need. And finally, as they are growing and multiplying and eating, they have to be able to avoid my immune system's attack on them to try to kill them. So a lot of steps have to happen for us to actually ever get sick. And thankfully, most of us have really, really good immune systems, strong immune systems, that are very good at fighting these infections off. Another example, let's take a look at a dog's ear and talk about an ear infection in a dog and what would happen as that infection occurred and what their body would try to do, what the ear would try to do to fight off that infection. So this is this is a model of a dog's ear, and this is the pointy part of his ear that you would see, and his ear canal, and it goes down here to his eardrum, his tympanic membrane. And we are going to say that this dog went swimming, got a lot of water in his ear, and because that ear canal is now wet and moist and not dry like it normally is, that is going to be the incident that allows these bacteria to suddenly stick to the skin of this ear canal and start to multiply and grow and create an infection. Now, this ear has become infected. And you can see that the ear is very, very red, and as the body is trying to use its homeostatic mechanisms to fight this infection, it's causing inflammation, bringing in white blood cells from the immune system to try to fight that infection. But as that's happening, this ear canal gets smaller and smaller and smaller, and now, because there is not very good airflow in here, and there's now moisture in here that got trapped, this infection is just going to keep going despite our body's ability to try to fight it off. And this is a case where we would now need to see the veterinarian and get antibiotics to actually help fight off these bacteria. Our body is attempting to get back to a homeostatic state, clear this infection, and make it look normal again with a nice healthy ear canal, but in the body's effort to do that, it's actually starting to make the problem worse instead of better. So homeostasis is a great thing, and our bodies are great at trying to keep everything where it wants to be, but sometimes it goes overboard, and that's when we need to be able to help.
We have another question there about kind of this, what you were talking about with using antibiotics.
Okay.
And the students would like to know, what is antibiotic resistance?
All right, that's a great question because that is a big problem. So, antibiotic resistance occurs when I have bacteria and I start using antibiotics to take care of this infection, and that's working okay. It kills some of the bacteria, but the antibiotic is either not at a strong enough dose or not being given long enough, and as a result of that, some of these bacteria, when they are exposed to the antibiotics at a low level, some of these bacteria are going to survive. And now that I have, and this turns into a survival of the fittest kind of a situation. Now I've got some bacteria that have died, but I've got a few that have survived, and now they are used to that antibiotic. And as this bacteria now multiplies again, he is going to pass on the traits to the new bacteria that say, oh, I can handle this antibiotic, this is no big deal. Now all of a sudden, I have microorganisms multiplying that antibiotic is not effective against. That is how antimicrobial resistance occurs. So if you ever find yourself on antibiotics, it's very important that you take them as instructed for as long as you are told to take them in order to prevent resistance from happening. Now that I have a resistant bacteria, I have to try a different, stronger antibiotic. And if we fall into the same situation where that antibiotic isn't taken like it's supposed to, I'm going to run into the same problem where some of these guys will die, but one or two will survive, and he'll start to multiply, and now I've got bacteria that are resistant to that antibiotic as well.
All right, thank you.
So let's talk about aseptic technique. Aseptic technique is what allows us to have surgery performed on us without getting an infection. About 200 years ago, if you got hurt and needed surgery, 50% of you would die from the infection caused by the surgery. And it has been with the development of aseptic technique that we have been able to now make surgery a routine thing where most people do all right. Aseptic technique is a procedure where the doctors and the nurses that are involved with a surgical procedure are able to prevent the spread of bacteria. We achieve asepsis by eliminating pathogens that can cause an infection. So, let's talk about how that is most likely to occur. Let's say that I have a dog named Fiona that has come to the small animal hospital at Texas A&M to have a routine spay procedure, a routine ovariohysterectomy, a procedure we do every day. Here on the screen, you can see the dog, and you can see the surgeon. We'll pretend that's me, and you can see all of my surgical instruments that I'm about to use. What is the most likely source of bacteria that would cause Fiona's infection? Would it be Fiona? Would it be me, the surgeon, or would it be my surgical instruments? It's not going to be me. because I'm going to use good aseptic technique. It's not going to be my surgical instruments because I will have sterilized those so they are completely free of any type of microorganisms. The most likely cause, the most common cause of postoperative infections, infections that occur after surgery, is from the patient itself, from their skin and the bacteria that normally live on our skin. So, when we are getting ready to do surgery, preparing the patient is one of the most important things that we do. We need to reduce the number of pathogens and microorganisms on that animal's skin to a level that their immune system can overcome any possible infection that occur. So, in order to do that, first we shave the surgical site. We have to get rid of all of the hair. Bacteria love to live in the hair. Now we are going to use a disinfectant on the skin, and that disinfectant will be some type of or combination of iodine, chlorhexidine, and or alcohol. And all of those are antiseptics that are very effective at killing microorganisms. Then, when we prepare to do surgery, we are going to place surgical drapes on the patient. And what this does is isolates the surgery site from all of the rest of the animal, all of the rest of the animal's hair and skin that has not been prepared for surgery. So we're going to keep any type of contamination from some other place on the animal's body from getting into our surgery site. And let's see, I am stuck. Okay, there we go. Now, that's what we'll do with the patient. It's very important that we as the surgical team also prepare ourselves. So the first thing that we're going to do as we get ready for surgery is we're going to do a surgical scrub on our hands and arms. We don't want bacteria and microorganisms from our hands to get inside of the patient. So we use special antimicrobial soaps that we apply to our skin for a certain period of time, anywhere from 3 to 5 minutes, that will kill most of the microorganisms that are on our hands. So we'll do a surgical scrub, a lot like what you'll see in TV. And the other thing that we will do is we will put on sterile clothing and get dressed for surgery. So we'll put on surgical scrubs like what I'm wearing now. And then we are going to go through quite a bit of steps in order to start surgery. We want to make it so that we don't have any hair from our head falling into the surgery site or any hairs falling out of our head into our surgery site. And we want to make it so that we are not breathing bacteria into the animal surgery site while we're doing surgery. So we're going to do a few things. We're going to put on a cap to keep our hair isolated so that we don't have any hair falling into the surgery site. We're not going to wear any kind of dangly earrings, and we're going to take off all of our jewelry. If you have a beard, you also have to put on a beard cover. And nothing will want to make you shave more than putting one of these things on. Okay? So you put this on, and you tie it around your head kind of like a bonnet. And now if I had a beard, this would hide my beard. I'm going to take this off because it gets really hot really fast. We're going to put on a surgical mask, and this is going to cover our nose and our mouth so that we do not exhale any bacteria, any microorganisms onto our patient. And then the last thing that we might do is that we have to make sure that we take care of ourselves as well. So if our patient has a disease that we could potentially catch, we don't want any sort of body fluids from the animal to splash onto our face or onto our eyes. So if we have a case like that, we're actually also now going to put on a face shield so that we have a barrier for that. So now we are dressed and ready to go into surgery. There's a lot of steps that have to occur for that to happen. There we go. Get all that off.
Dr. Stickney, I have
Yes.
a question. It's a good one.
All right.
How long does it take you to get prepped for surgery?
Well, I do it a lot, so it doesn't take me very long. The surgical scrub that I do is about 3 minutes long with the antiseptic soap that I use, and putting on all of this gear on my face and head. Pretty much, it's kind of like brushing your teeth now. It's automatic, so I don't really think about it very much. So I can be dressed and ready for surgery and in the OR in about 10 minutes.
That's pretty good.
So we have now put on all of the barriers that are going to help keep us from adding any sort of pathogens to our patient. We're covering our hair, taking off our jewelry. After we do our surgical scrub, we are now going to put on a surgical gown and surgical gloves, and those are all sterilized, which means that they are completely free of any type of microorganism at all. We can never make ourselves sterile, and we can never make the patient sterile, and that would mean that we would have to be able to kill every single microorganism on the patient's skin and every single microorganism on our hands, and we would never be able to do that. There's no way to do that without destroying your tissue. But we can make our instruments and our gowns and gloves sterile, and we are able to do that by treating them with chemicals. What we typically do with most of our instruments is put them in an autoclave, where we use a combination of heat and pressure to kill every single microorganism on it. We can also use radiation or gas that will kill all of those microorganisms. And then we have ways that we can check all of our supplies to make sure that they are sterile. We place a little tag of paper in the pack, and that tag will change colors when the items have been sterilized. And we also can put special tape on the outside of the package that will show little stripes on it when the item is sterile as well. And then most of our equipment that we use is one-time use only, like syringes and needles. So they come sterilized from the company. You open it, you use it once, and then you throw it away.
Okay, we have another question before we move on. And they want to know, you said that historically, before these techniques were in place, the survival rate was 50% for surgical procedures. What is the survival rate now?
Okay, so that depends a little bit on what the surgical procedure is. And it depends a little bit on how sick you are at the time of surgery. So, for example, if I have an animal that was hit by a car and had heart disease and kidney disease, that animal has a really low survival rate because it has other things going on. But if I have a perfectly healthy puppy that's coming in for surgery, if I use good aseptic technique, the risk of getting an infection is less than 0.1%. So the odds are really, really good that you will not get a post-operative infection if you use good aseptic technique.
That's a huge improvement.
It is. It is a huge improvement. It's a good thing to live nowadays and not 200 years ago.
Yes.
Finally, the other thing we have to keep in mind when we do surgery is the surgical environment. So, like we said before, microorganisms are in the air, right? They're on every surface, and when we touch a surface or brush against it, some of those microorganisms go up into the air. Every time I breathe, microorganisms are coming out of my mouth and floating around in the air. So we want to have an environment, a surgical suite, where we minimize those types of things from happening. Things that we want to do when we are in the surgery suite is we try to minimize how much we move around so that we're not stirring up microorganisms, and we try to minimize the number of people in the surgery suite. The fewer people that are breathing and exposing the air to more pathogens. Our surgery suites have positive pressure airflow. So what that means is that when the ventilation system is made so that air is sucked out of the room, dirty air is sucked out of the room, and then fresh, clean air comes into the room so that we are not recirculating any type of microorganism that could be in the air. So We know that there are microorganisms everywhere, and we know that right now all of us are covered in a zoo of microorganisms, and our desktops are covered in microorganisms. So let's talk a little bit about things that we have nearby that we can use to help prevent infections and reduce those numbers of microorganisms. So one thing would be having a first aid kit handy so that if you do injure yourself, get a cut or a scrape, you're able to wash it off, clean it off right away, and then cover it. Cleaning and covering a wound is one of the best ways that you can help from getting any type of an infection in that injury. Using hand sanitizer or washing our hands frequently is one of the most important things that we do, because we touch stuff all the time, and without knowing it, you are constantly, after you touch something, you're always touching your face, your nose, your mouth, rubbing your eyes, and every time you do that, some virus that I just picked up off this table can end up in my eye or in my nose, and the next thing you know, I've caught a cold or I've caught the flu. So using hand sanitizer frequently, washing your hands frequently, especially before you eat, is very important. And there is a difference between running your hands under the water with a little bit of soap, 5 seconds later walking away and saying, I've washed my hands, okay? In order to really wash your hands and eliminate as much as possible the number of microorganisms on them, you really need to wash your hands for about 30 seconds with warm water and plenty of soap. So what they say is that as you wash your hands, sing the ABC song in your head. And when you get to Z, now you're ready to rinse off your hands, and that will have been enough time to truly get your hands clean. Another thing to bear in mind that's really important is that your interdigital spaces, the spots between your fingers and between your finger and thumb, those are places that are often neglected when we're washing our hands. So you want to make sure that you get into those spaces as well as you wash your hands.
Okay, we have another question.
Well, perfect, because we are at a spot for questions.
They would like to know, is it better to wash your hands or use hand sanitizer?
All right, so that's a great question, and generally both are very effective. Hand sanitizer is great because it's convenient. We can keep hand sanitizer in our pocket, and when you go to the grocery store and start pushing that cart around, who knows how many people before you have pushed that cart around. So after you're done doing that, it's really easy to reach into your pocket, pull out some hand sanitizer, and use it. So hand sanitizer is great. But if your hands are physically dirty, and you look at your hands and you know that they're dirty, washing them is going to be way more effective than hand sanitizer.
Right. And our next question is, why is the flu so bad this year? And I think maybe by bad they mean so prevalent.
Yes, so that is a good question, and I'm not an epidemiologist, so I may not have an exact answer for it. But one of the reasons is that the flu vaccine that we gave this year is effective against some strains of the flu, but not effective against other strains. So the strains that the flu vaccine is not that good against is the one that's floating around right now, and people are getting that, and then they're getting sick.
It's very unfortunate for all of us.
Yes, it is. All that pain for nothing.
All right, and we have one other, and they'd like to know, are some antibiotics no longer effective at fighting disease?
So there are some antibiotics that are not as effective against specific microorganisms. There are pretty much all of the antibiotics are still effective in the right circumstances with the right diseases. You could, if you wanted to, you still use penicillin, the very original first antibiotic we ever had. There are still bacteria that would be effective against. But over time, we have seen bacteria that have become less and less prone to being stopped by those earlier antibiotics. So the answer is no, there are not antibiotics that are completely useless anymore. But we are finding ourselves in a spot where we're not careful that we have to use stronger and stronger and newer antibiotics.
All right. And we have another question. They'd like to know, is hydrogen peroxide a good way to avoid infection?
Hydrogen peroxide looks really exciting because it foams up and you say, oh, well, it's got to be working. It stings and it's foaming up. But it is actually not effective at all at killing bacteria and cleaning a wound. Really, the only thing it would be good at is if there was dirt in that wound, maybe some of that foam would help lift out that dirt. You are much better off to use simply soap and water and clean that wound than to try to use hydrogen peroxide.
Right. It's very interesting because, yeah, we all like to see the fizz, don't we?
Yes.
All right. And we've got one that they'd like to know, what type of animals do you work with at A&M?
So I work primarily with dogs and cats, and I do elective surgery. So we're primarily working on healthy pets and doing procedures that they need to have performed in order to stay healthy. So a lot of spays, a lot of neuters, some other procedures like that. However, I also do a lot of exotic animal surgery. And for example, just last week we had 2 guinea pigs that had to get spayed. So I did guinea pig surgery.
Some tiny.
Very tiny instruments.
I guess you have specialized instruments for all your different sized animals, right?
Yes.
Okay.
And specialized instruments for different organ systems. Like if you're doing eye surgery, your instruments are much tinier than the instruments that I would use to do abdominal surgery.
Right, yeah. They'd also like to know now, how do you become a veterinarian?
So becoming a veterinarian is it's a kind of a lengthy process. Veterinary school, it starts now and it starts in high school. So veterinary school is very, very competitive. We have over 500 people apply every year for about 130 spots. So that means that you've got to do very well in school all the way through high school and into college so that you have great grades and are involved in lots of activities to show that you're able to multitask and still do well in order to apply to vet school. So what will happen is that you'll complete high school and you'll go to college and you will have to take a certain number of courses as prerequisites for vet school in your undergraduate years. So that will take anywhere between 2 and 4 years of undergraduate work in college. Then, once you're accepted into vet school, veterinary school is a 4-year program. So when you graduate from high school, you are looking at a minimum of 6 years to become a veterinarian after that.
It's a long process.
It's a long process.
Is it
but
rewarding?
it's worth it. It is very rewarding. It's something new every day.
Yeah. So what's your favorite aspect of veterinary medicine?
Well, I'm going to say surgery because that's what I really, really like to do, but there's lots of exciting things that you can do. A lot of people like internal medicine, where an animal has some type of a disease and you have to run a lot of tests and interpret all of those tests and figure out what's going on with the pet, and then you have to figure out what medicines are going to help that pet, and you have to tweak those and adjust those just right to make the pet feel better, and some people find that very, very rewarding as well.
All right. Well, I think that about wraps it up for us today. So we thank you for being here with us. If you'd like to learn more about veterinary medicine or other aspects of STEM education or careers, we invite you to visit our website at peer.tamu.edu, and we look forward to seeing you for our next webcast, where we'll learn something else about our science and veterinary medicine and health that surrounds us. Thanks again for being with us.